2020 is a year that will mark everyone, especially those in the healthcare system. Since the year 1918, the world has witnessed 5 pandemics, with COVID-19 being the recent one. A healthcare professional's life is usually not the same, especially during critical moments like pandemic outbreaks, wars, disasters, and other crises. A couple of things usually run through one's mind when they are called to service during such moments. Thinking of how to cope with the situation and the family demands is usually one of the major challenges to deal with. But then, one would have to face the challenge and do what the profession demands. As the number of people infected with the virus multiplied, Qatar's government doubled its effort to curb the spread and to accommodate the patients by increasing the number of hospitals as well as the workforce.
Immediate training was given to us on how to handle COVID-19 in the next days.
Bigat, sobra. Bigat sa pakiramdam, bigat sa kakaisip sa pamilya. Kung paano sila poprotektahan, invisible ang kalaban.
Lepsia Field Hospital, LFH, is one of the recently built quarantine facilities in Qatar as part of System-Wide Incident Command Committee, SWIC, and Ministry of Public Health Strategy, along with Hamad Medical Corporation, HMC.
It's everyone's responsibility worldwide, individually and as a group, to fight this virus and to prevent it from spreading all around. Everyone's working with their specialty and doing what they are good at in terms of fighting this virus. Here in Lepsia Field Hospital, we have a very strong team built from doctors, nursing, admins, and allies. During the first few weeks of the start of the hospital, everyone was doing the best they could. It wasn't that just nursing doing nursing, doctors doing doctors, admins doing admins. No, everybody was doing everything they could to build this hospital and keep it running, because when the army handed the hospital over to us, it was a great challenge for our team to keep on the hospital running.
In this pandemic situation, we are mainly concentrating on some of the protocols, such as social distancing, that means 1.5 meter, and hand hygiene.
The interim of the use of personal protective equipment is being updated on currently available information about COVID-19 and the current situation in many countries.
In this crisis situation, we are mainly focused for the social distancing, that is 1.5 meter, and hand hygiene, that we can use as medical or the surgical hand hygiene, and the proper usage of personal protective equipments. Before doing all these measures, we have to follow how to do the donning and doffing techniques. Personally, for these measures, we can protect ourselves and others from this COVID-19. At first, the moment when I got the information that I have deployed to the COVID unit, the new unit in the quarantine facility, I was totally confused and the emotion was unexplainable for me. The main concern was how I'll take care of my family members, and my friends.
WHO recommends the use of additional infection prevention and control measures by healthcare workers during this period of the pandemic, along with standard practices recommended as part of the routine healthcare delivery to all patients.
السلام عليكم، أقدم نفسي. أنا هيفا، أشتغل حالياً ممرضة متطوعة بمؤسسة حمد الطبية لرعاية مرضى كوفيد-19. منذ طفولتي كان عندي شغف كبير في مساعدة الآخرين، وهو كان سبب من الأسباب الكبيرة اللي خلتني يعني أقرر أني أكون ممرضة وأخوض مجال التمريض. في الحقيقة هو مجال فيه بعض المخاطر، لكن أهم شيء لما شوفت ابتسامة المريض وتعافيه من المرض يفوق أي مخاطر.
In the face of this crisis, it's reassuring to know that these workers are there to administer treatment and give advice. However, with more than half of the world's population lacking access to essential health care, what happens when there aren't enough doctors, nurses, and support staff?
بالنسبة للحديث عن مشاعري، يعني بالفعل لما التحقت بالشغل ككادر صحي في الصفوف الأمامية لمكافحة كوفيد-19 كانت مشاعري ما بين القلق والضغط النفسي والخوف كمان، لكن رغم هذا كان عندي 3 مبادئ أساسية. أول شيء هو التضحية، هو بالنسبة لي يتمثل أني قسمت حياتي ما بين الأسرة ما بين العمل، وفي نفس الوقت تجنبت قدر الإمكان حتى ما أعرضهم لخطر الإصابة بالفيروس وحماية نفسي وحماية عائلتي. بالنسبة للمبدأ الثاني هو الأمل أنه زوال هذا الفيروس ونرجع نعيش حياتنا الطبيعية بكل أمان وسلام. وأهم شيء من مبادئي طبعا هي في الحياة هو مساعدة الآخر لقضاء حاجته. عملي كممرضة متطوعة لم يكن من السهل ممارسته، والسبب أنه من اللازم تعلم كل المهام بشكل سريع ومتقن، وفي نفس الوقت التأقلم مع الوضع والأزمة والتكيف مع زملائي بمختلف خلفياتهم ومعرفتهم المهنية.
It's estimated that about 200,000 healthcare workers have been infected with the virus. According to the International Council of Nurses, at least 260 nurses have died of the virus.
Acquiring the coronavirus is one thing, but being isolated for more than 2 weeks is another. It was lonely and depressing. Fear overshadowed me if I will ever survive this virus, especially during the days that I was feeling unwell. Because I wasn't certain what will happen next. If I will be negative on the next test, or will I develop any more symptoms. But my family and friends who were supporting me made me feel like I wasn't alone during my fight. They gave me provisions of food and other necessities that helped me get my strength back in no time. They made me feel like I was at home. It kept me going on and believing that there were people waiting for me when I finished my quarantine.
While not ideal, in situations of critical staffing shortages, some facilities have conferred with the local public health authorities and allowed healthcare workers with suspected or confirmed COVID-19 to return to work earlier than indicated in the recommended return to work strategies. This has been determined on a case-by-case basis, and facilities have considered duty restrictions such as only permitting infected healthcare workers to care for patients with COVID-19.
The special thing in Qatar that we had is the preparedness, that we were ready and we were lucky that our infrastructure and health was really strong enough to be able to cope with this. Another unique thing is that the people in Qatar, regardless of Qatari or non-Qatari, they worked as one team, harmony. They were able to do everything to overcome this crisis, and they proved this. I think we were working as a one single family, and this is most likely the reason that why we went smoothly through this crisis. We were lucky to have leaders and managers. They were hidden somewhere, and they came out in the front line, and they were leader by nature, and the COVID gave them the chance to prove themselves. And I was lucky in Lubsair to have many of these people around me, and I was really impressed by their work, whether regarding clinical or non-clinical employees.
Although the world is still engulfed in the dark clouds of this pandemic, the dedication shown by the frontline warriors brings a much needed light at the end of the tunnel. A light that signifies a new beginning and healing to the world that succumbs to the COVID-19 virus this year. With all their hard work, 2020 is without a doubt the International Year of Nurses and Midwives. Yet, one question still lingers on the minds of many. How much longer do we have to battle to completely defeat this coronavirus? The world and Qatar can be assured, however, that the brave frontliners will be there till absolute victory is brought to them.